Welcome to Dil Se Dil Tak, a public awareness program regarding the healthy heart. This is Dr. Mrinal, your host for today. We have some alarming statistics. Indians fall prey to cardiovascular disease about 10 years ahead of the West. Not only that, every 33 seconds, one person is dying of cardiovascular disease in India. That's quite alarming. But IPCA has launched an initiative to circumvent this problem. It has partnered with the renowned medical community, Fraternity of India, to launch a patient awareness program which actually can teach them about the healthy heart. Today, we have an elite panel of cardiologists from Calcutta who are of national and international repute, who will talk more about healthy lifestyle, healthy heart, about the heart attack, how to prevent it, and what are the steps we can take. I welcome all of you today. Next, I would like to introduce somebody who is the President-elect of Cardiology Society of India, one of the renowned cardiologists from across India, national and international repute, Dr. Mrinal Kanti Dash. We would like to see one video about him, what is his message to the audience.
Music is the rhythm of life, and who will understand it better than a cardiologist? Because our heart beats in a rhythm. Introducing a cardiologist, whose mission in life is to alleviate human heart suffering by developing comprehensive understanding of heart diseases for complete relief. Based on his research work, incidentally, one disease in his name called Das and Parua syndrome has been proposed. Meet Dr. Mrinal Kanti Das, a renowned cardiologist from Kolkata, whose melodious whistle we just heard. Currently, Dr. M.K. Das is associated as Senior Interventional and Consultant Cardiologist with B.M. Birla Heart Research Center and Calcutta Medical Research Institute in Kolkata. Dr. M.K. Das is the current President-elect of the Cardiological Society of India. In past, also he had a long stint on serving CSI in various capacities, such as Treasurer, Vice President, Executive Committee Member, etc. Dr. M.K. Das, after his MBBS and MD, did DM in Cardiology from IPG MER Kolkata, post which he earned many prestigious international certifications in the field of cardiology like FICP, FICC and FCSI. Dr. M.K. Das is an extraordinary achiever right from his school time, where he received gold medal from the Chief Minister of Assam in 1972 for securing excellent rank in state examination. During his DM in cardiology, he was awarded with the gold medal for best paper presentation. Dr. M.K. Das' philosophy in life is that a candle loses nothing by lighting another candle. That's why he believes in sharing his knowledge with everyone. He is at present co-editor of the CSI textbook of cardiology, faculty and national expert of the Public Health Foundation of India. He has also worked as the editorial secretary of Indian Heart Journal. While working as honorary general secretary of CSI, he has published a book to raise public awareness about good heart health in India titled 10 Commandments. Subsequently, it was translated in 11 Indian languages. His poem, Give Thy Hands, Give Thy Hearts, was also published in the Indian Heart Journal. Dr. M.K. Das has presented papers at various national and international conferences, and he has written chapters in textbooks of cardiology, textbook of echocardiography, and CSI update books of cardiology, to name a few of them. Dr. M.K. Das was felicitated by the Rotary International Kolkata for his active involvement in benevolent activities on health and education for the needy people. He is also associated with Nishabd Angikar NGO, which was instrumental in building female toilets in Sundarbans in 2012. Let's listen to a healthy heart message from Dr. M.K. Das, the rhythm specialist.
This is my message to all the people, whether they are patients or not patients of cardiovascular disease. We should know that there are two hearts. One heart which is catchable, which you cannot see, but we can fathom. And there is another heart that is called the real heart, what we can see and we can feel and we can also touch. The surgeons and physicians, they are doing the things on this particular heart, whether with the medicines or with the scalpels or with any other kind of devices. Now, when I speak about two hearts, that first heart is very, very important because that influences the second heart that is residing in our body. The other heart, which may get depressed, may get elated because of good news or very much welcoming news, that will actually not only enchant the system of our body, but also the whole hormonal milieu in our system. So if your heart is well, if you feel good, if you are happy, then your structural heart also will remain happy. I always quote a poem which has been written by myself. It's a long poem, but I am just mentioning the last two lines. Give thy hands, give thy hearts, to whomsoever. Enjoy the life, enjoy the earth, enjoy the heart forever. Now, most of us talk about the risk factors like stress, hypertension, hypercholesterolemia, obesity, diabetes mellitus, smoking, excessive salt intake, lack of physical exercise. So all these are known to most of us. But how we can modulate ourselves to go into the system, that is possible if you have a good mental heart, not the structural heart. If you have that heart, then from nature, it will be reflected in your structural stress generated in our system. And this is mediated by one of the hormones known as adrenaline or catecholamines. Now, very interestingly, these catecholamines can constrict the vessels which carries the blood to the body. Now, these vessels, after being constricted, will generate high blood pressure, and not only that, they will also cause high heart rate problem, and ultimately all the risk factors will be coming into play, causing the coronary artery disease or heart failure or hypertensive heart. All this will be happening because of our going away from nature. Now, I give you one very interesting part of our life, especially for the doctors. Doctors who treat the patients and they give advice to the patients that you should do this, you should do that. But do you know the doctors, they don't even follow the basic principle of sleep. One must sleep for at least 6 to 7 hours a day, but instead of that, they, or even some other professionals, they are also doing same kind of things. They work for so many hours that they don't follow the usual sleep pattern. Usual sleep pattern, there is a condition called diurnal variation, and there is also a condition called nocturnal dipping of the blood pressure. And this nocturnal dipping of the blood pressure actually helps to a great extent to avoid catastrophe at night. And there is another condition called morning surge. That morning surge of catecholamines and high blood pressure might create some diseases like acute heart attack and all. Now how can you prevent that? If you just go to the bed early, as is being done by most of the animals and plants on earth, then actually your process of good sleep will happen, and there will not be sleep deprivation, and there will not be any sleep disorder which might be associated with sleep apnea syndrome, and that sleep apnea is responsible for a group of cardiac disorders, not only hypertension but also arrhythmias, then heart blocks, then obesity, then cardiopulmonary dysfunction. And these problems can be averted just by taking a good sleep. So what I am trying to pass to you, that you will be controlling the risk factors definitely, but go beyond that. You can prevent them, prevent hypertension to occur, prevent diabetes to occur, prevent obesity to occur, prevent coronary artery disease to occur in yourself by doing or by carrying out a healthy lifestyle. So that's the message I would like to put to all of you, that you not only give something to the world, but also try to follow the principle of practice before preach. And if you do that, definitely you'll be having a very, very good heart. Thank you.
Please take a seat. The whistle reminded me of the Raj Kapoor movies for some time. Sir, we would like to ask one important question. Is that when we get the symptoms of heart attack, anybody, people tend to differentiate, people tend to think it as a gastric problem, and they take all the Enos and everything. And then the second time it recurs, they go into a heart attack and then cannot reach the hospital. So how do they differentiate between a gastric problem and a heart attack? What are the things they can do?
This is a very, very important question, as well as a point which should be passed to everyone who are listening to this particular program. Now, heart attack symptoms and gastroenterological symptoms, sometimes they might converge or they might mimic, we call mimic. So, one must be very much aware that if you miss the crucial time, that is the first hour after heart attack, by thinking that my problem is due to gas, then really you are going to have a lot of problems later on in the form of heart failure, in the form of cardiac arrhythmias and all this. Now, classically, the heart attack pain has got few characteristics. Number one, it will persist for some more time, more minutes. It's not like that it comes and goes, comes and goes. It's not like it will be persistent. Second, it will not be related exactly to the exertion. Exertion means you are walking, then you are getting pain. It's not like that. It's persistent even at resting position. Third, it might be located in the retrosternal, that is just in the central part of the chest, but at times the pain may be radiated to the other parts of the body, like it is going to the left side, left arm, or it might even go to the right side of the arm, and very interestingly, the pain even may go up, that is to the jaws, and you might be having a feeling like compressing the jaws. So that feeling is very, very indicative of something related to the heart. Same way, when I am talking about the pain, there are other components which might be associated with it, with the heart attack. So one of the points is the compression, the feeling of compression in the chest, that is a very, very suggestive symptom. Apart from this, if a person is having sort of dizziness or giddiness, it indicates the pressure is falling. And that falling of the pressure, which in our term we call hypotension, that might actually be another indicator. Sometimes even somebody might get suddenly down to the earth because of the hypotension to such a level that brain cannot actually maintain oneself in erect position. And before that or during that time, one might be having the feeling of sinking, as if I am now going beyond this life. So that feeling of sinking is also another feeling or another suggestive symptom of heart attack. Now, when we are correlating with the gastroenterological problem, mostly it comes in the form of pain in the upper part of the abdomen, which is very much confused with the most of the people, because they cannot differentiate. When the patient is coming to us, they are saying, there is some chest pain. Now they are showing it or pointing it to the actually upper part of the abdomen. But in the gastroenterological system, there can be pain on the retrosternal part also, but that will never be associated with some of the features like compressive feeling and all, and that may not be associated with a very grave symptom or even sign that is known as perspiration or sweating. That sweating is a very, very great indicator. Now, apart from this, there might be vomiting along with the, say, upper abdominal pain or chest pain. One might confuse it with the gastroenterological problem, but that will be to the detriment of the, we call it, prognosis of the patient. Because if the person has really a heart attack. Why I am saying this? Because there are different parts of the heart. We call it anterior part, lateral part, inferior part. Now the inferior part is just sitting on the diaphragm, and below the diaphragm the stomach is there. Naturally, the nerves which are taking part in both the stomach as well as the heart, so they will be having common sort of interaction. So a symptom which is produced from the stomach will be reflected there or vice versa. But you must remember that it will not be associated with sweating, it will not be associated with palpitation, it will not be associated with the coldness of the extremities. So these are some of the features by which one can pick up or one can differentiate. Another point, what you have already mentioned, that by taking the antacids or or like that of kind of medicine, there will not be relief of the chest pain or compressive type of feeling. And that's why I must tell everyone that whenever there is even a pain in the upper part of the abdomen, you must consult the doctor immediately so that the maximum benefit can be offered to that patient who has actually sustained heart attack.
So it is better to give the benefit of doubt and contact the doctor or cardiologist or a hospital A&E immediately. Even if it's in the middle of the night, rush to the hospital, do an ECG and take it from there.
Surely. If there is uncontrollable sugar, diabetes mellitus, the control hocche na, then you get ready for impending problems in the form of ischemic heart disease or arrhythmia or even other form of heart diseases like heart failure and all.
Next question is for Dr. Das. Dr. Das, we would like to know how you differentiate and decide that this patient needs angioplasty and this patient, the other group of patients need a CABG or a bypass surgery. How do you differentiate between the two?
Well, this is another important question actually, which is faced by all of us, by all the patients who are having heart disease. Now, heart disease with coronary artery block. Now, one must know that there are actually, I am showing this, So there are actually 3 coronary arteries. On the left side there are 2, and on the right side there is 1. Now apart from these, there may be so many other branches of the artery, coronary arteries, which are named differently. Now based on the number of arteries involved, the decision regarding the angioplasty or PTCA we call it, or CABG are decided. Now basically when there are 1, 2 or 3 arteries which are at accessible place, then they are good candidates for angioplasty. Again, if these 3 arteries are blocked but the person is having diabetes mellitus, then in that case we have found that the stenting which is done is a ring which is put inside the blocked artery after it is inflated with the balloon. So the results of the angioplasty in coronary artery block, multiple coronary artery blocks with diabetes mellitus is not that good. So that will be a candidate for actually coronary bypass graft. Now many times what happens, the arteries may be blocked in such a way, or there might be 1 or 2 arteries which are totally blocked, and on the right side there is 1. Now apart from this, there may be so many other branches of the artery, coronary arteries, which are named differently. Now based on the number of arteries involved, the decision regarding the angioplasty or PTCA we call it, or CABG are decided. Now basically when there are 1, 2 or 3 arteries which are at accessible place, then they are good candidates for angioplasty. Again, if these 3 arteries are blocked but the person is having diabetes mellitus, then in that case we have found that the stenting which is done is a ring which is put inside the blocked artery after it is inflated with the balloon. So the results of the angioplasty in coronary artery block, multiple coronary artery blocks with diabetes mellitus is not that good. So that will be a candidate for actually coronary bypass graft. Now many a time what happens, the arteries may be blocked in such a way, or there might be 1 or 2 arteries which are totally blocked. They may not be opened up by the usual process of angioplasty. In that case, if it is associated with another artery which can be opened up, but we usually don't go for the angioplasty in those kind of cases also, and we straightway advise the patients to go for the coronary artery bypass graft. So according to the severity of the illness or severity of the coronary artery involvement, we advise whether the person will be benefited with the coronary angioplasty or by the CABG. There is another group where there are multiple coronary arteries involvement are there and associated with heart failure. Heart failure is the failure in the part of the heart to pump adequately. Now that pumping failure is likely to have more sort of mortality. Now, if that patient is to be benefited, one can go for the angioplasty if the person actually denies the benefit of CABG. Otherwise, they are also good candidates for coronary artery bypass graft. And of course, when a critical block is there and the angioplasty has picked up that block and there might be imminent danger, automatically we don't waste time. We straightway go for the angioplasty rather than the CABG. Another group might surface during the time of angioplasty. The angioplasty patients is having some complications. Complications in the form of rupture of the coronary artery or severe sort of arrhythmias or like that. In those cases actually, many a time, we take the help of the cardiac surgeons, and they might go for a bailout surgery. That has happened, I think, in most of the cardiologists' life. So bailout surgery is also done. So the crux of the problem is severity of the illness, number of arteries, and associated with any other diseases. These all will determine whether I'll be choosing the angioplasty or the bypass surgery.
Okay, and so before even deciding, so you discuss everything with the patients and the relatives?
That's a must. In fact, before any procedure, one must explain the patient what I am going to do. Say, for example, the angioplasty. I can do the angioplasty both by the radial artery in the upper arm or by the femoral artery in the lower limb. Now, I must explain what are the pros and cons of these procedures. I must explain. I always take that time to explain the relatives as well as the patient that whether you are comfortable with the test or not, because it has got certain risk of the complications. Now, same way with the angioplasty procedure or with the bypass also, the explanation is a must, both from information point of view and also from legal point of view. And after only they have given the signature that yes, I have understood the methodology and the procedures, then only we subject the patient for angiography, angioplasty, or even the surgery.
Thank you very much, Dr. Das, for your insights.